Hello friends, this is the picture of chest x-ray which is showing here, that is coarctation of aorta. Not only that, if you see, there should be notching of ribs seen. Okay, but not that good. But here you can see some notching which you can see. This x-ray is poor in quality. Here, yeah. 1 minute, I'll show you. This is the notching which you can see here. See, this is not the notching of ribs which you can see in coarctation of aorta. Now, are there any conditions where notching of ribs are seen? That means, what are the differential diagnosis of notching of ribs? Notching of ribs is mainly seen in arterial conditions like coarctation of aorta, aortic thrombosis, subclavian and obstruction, or any pulmonary oligemia. It is also seen in venous conditions like superior vena cava obstruction or arteriovenous pulmonary arteriovenous malformations, or it is seen in chest wall arterial malformations. This notching, rib notching, is also seen in neurogenic or neurofibromatosis. Whereas if you see, the superior rib margin is seen in connective tissue disorders like rheumatoid arthritis, systemic lupus erythematosus, and Sjogren syndrome, metabolic disorders like hyperthyroidism, and miscellaneous conditions like neurofibromatosis, restrictive lung disease, poliomyelitis, Marfan syndrome, osteogenesis imperfecta, and progeria. All these will show superior rib notching. So thank you guys for watching my lecture. Thank you.